So you just got your first vial of weight loss medication in the mail. Congratulations. What do you do next? You have options. You can bring your vial into our office and I'm happy to draw up your medication for you. We can draw up every single dose or certain increments of dosing, or you can watch the following video and learn how to draw it up at home on your own. This is great for a more convenient option, especially if you travel, and it's super simple to do. Now, I will say everybody is different with the kind of syringes if they're drawing up at home. This is a 100 unit, 1 milliliter syringe. I pop the back off of my cap, and then you're gonna remove your vial from the prescription box that it comes in. That box has the amount of units or volume that you're going to draw up. Your units are volume only. It will not be the same as the milligram amount of medication you're on. So pay attention to how many units it says to on your vial or on the box that your vial comes in. That's what's telling you how much to put in our syringe. You're going to take off the plastic top and you just pop it off with your thumb. You'll hear that little crunch. And then I always use this little window on the vial in between the stickers just because it's a darker area. And once we get down to a certain amount of medication, we want to be able to see where the needle is in the vial. But for your first dose, you really don't have to worry about it. You're going to flip your vial upside down. You're going to uncap your needle and insert it into the rubber stopper right in the center of the circle. You're going to turn your unit amount to you so you can see how many you're drawing up. And let's just say we're doing a starting dose, which would be 2.5 milligrams. For this vial concentration, that's 15 units. I'm going to turn it so everyone can see. And you're going to pull down past the 15 unit mark, which is right there. But because we tend to get some bubbles in the vial, which aren't harmful when we're injecting into the subcutaneous tissue, but we don't like bubbles. So I usually pull back a little bit past our dose, and then we push up to the dose. You can give it a tap if it still has a bubble. And back up to your 15 unit mark. And then you remove your needle and you are ready to inject. It may not look like there's much medication volume in your vial. Let me show you what 1 unit looks like when we express it out of the syringe. We're drawing up only 15 microdroplets for that base dose in this concentration. So when you receive your vial and you notice that there's not much medication in there, that's okay. It's very concentrated. To get a 2.5 milligram dose out of our higher dose concentration vials, we're only drawing 15 microdroplets of the medication. So even though it seems like a very small amount of medicine, we're drawing up little tiny fractions of the actual volume because the medication's so concentrated. A few other things: don't forget to refrigerate your medication, whether you're on semaglutide or tirzepatide. It's important to keep them in the fridge, though you do have a little leeway. So if you have questions, if you've left it in your car or your purse and forgotten about it, it does still show 99.9% efficacy at 9 days out of the fridge up to 104 degrees for either medication. So don't stress about that if you've left it out. It's also fine to leave your syringe out prior to injecting if you find that injecting the cold fluid is a little more painful. Play with it a little bit. That's okay. We also want to make sure that after you inject, you recap, and you can use the flat bottom of the top of the cap, place it on a counter or a table, and then take your syringe like a dart and recap that way and push tight. Then you can throw these in the trash can as normal because it's capped. It's not a risk to anybody as far as getting poked. Or some people will choose to put it in a laundry detergent bin instead of getting expensive sharps containers. If you have any questions or anything comes up while you're injecting that you weren't anticipating, call us and let us know. You can reach us via our business phone number. I'm always happy to answer your questions. And if you really just don't feel comfortable drawing up your own medication, come by the office and see me. I'll help you out.